Lauge-Hansen classification of ankle fractures. The Lauge-Hansen classification is a system used to describe ankle fractures based on how the injury occurred or mechanism of injury. It was developed to help understand the pattern of fractures and associated ligament injuries. This system focuses on the position of the foot at the time of injury, supination or pronation, the direction of the force applied, external rotation, abduction, or adduction. This results in 4 major injury patterns, each with a predictable sequence of bone and ligament injuries. Key terms to understand. Supination. Foot is turned inward or upward, like standing on the outer edge of the foot. Pronation. Foot is turned outward, like standing on the inner edge of the foot. External rotation. Twisting motion of the foot outward. Abduction. Force that pushes the foot away from the body. Adduction. Force that pushes the foot toward the body. Lauge-Hansen patterns. 1. Supination external rotation. Most common pattern of ankle fractures. Sequence of injuries. Tear of the anterior inferior tibiofibular ligament. Spiral fracture of the distal fibula. Tear of the posterior inferior tibiofibular ligament or fracture of the posterior malleolus. Medial malleolus fracture or deltoid ligament rupture. 2. Supination adduction. Less common than SER. Sequence of injuries. Transverse fracture of the lateral malleolus, below the syndesmosis. Vertical fracture of the medial malleolus or compression injury to the medial tibial plafond. 3. Pronation external rotation. Second most common type. Sequence of injuries. Tear of the deltoid ligament or fracture of the medial malleolus. Tear of the anterior inferior tibiofibular ligament. Spiral fracture of the fibula above the level of the syndesmosis. Tear of the posterior inferior tibiofibular ligament or fracture of the posterior malleolus. 4. Pronation abduction. Rare injury pattern. Sequence of injuries. Tear of the deltoid ligament or fracture of the medial malleolus. Transverse or comminuted fracture of the fibula at or above the syndesmosis. Tear of the posterior inferior tibiofibular ligament or fracture of the posterior malleolus. How to use this classification in practice. Identify the mechanism of injury. Ask the patient how they fell or twisted their ankle. Check imaging, X-ray or CT. Look for fracture lines, displacement, or ligament injuries. Match the injury pattern. Use the sequence of injuries described above to classify the fracture. Why is this classification important? Helps predict associated injuries, even those not visible on initial imaging, for example, ligament tears. Guides treatment planning, for example, whether surgery is needed to stabilize the joint. Provides a standardized way to communicate with other healthcare professionals. This simplified understanding makes it easier to remember and apply the Lauge-Hansen classification when managing ankle fractures.